So welcome everyone. Today we're going to be talking about HIV and AIDS and dating and domestic violence. My name is Marcelino Abzamalek. I am part of the prevention team at the CARE office. My pronouns are he, him, his, and I'm going to give the opportunity for Itzel to present herself.
Hi everyone, my name is Itzel Otero Castañeda. Pronoun she, her, hers. I'm also part of the prevention team and I'm really excited to be your co-presenter today. Before we get started, we do want to give out a trigger warning. So this presentation does include potentially distressing content and images. So if you need to step away at any time, please feel free to do so.
So you might be wondering who's presenting this presentation. So we are from the CARE office. CARE stands for Campus Advocacy Resources and Education Center, and we address stalking, violence, assaults, and so on through our presentations to educate our community. And we also have our advocate Lena, who can help a survivor throughout any difficult times in their life. By call or text, she can help folks with academic accommodations, housing, or legal support, and through a lot of things. So make sure if you need to call her, give her a call or a text. And since Lena is not on the 24-hour shift, we have our good relationship with our Valley Crisis Center who are 24 hours, 7 days a week. So you can call them on Christmas Eve at 1 o'clock and someone will be able to assist you on the other side of the line.
So what is AIDS Day? So World AIDS Day was first observed in 1988. Each year, organizations and individuals across the world bring attention to the HIV epidemic, endeavor to increase HIV awareness and knowledge. They also speak out against HIV stigma and call for an increased response to move toward ending the HIV epidemic, a plan for America. 2020's theme was Ending the HIV/AIDS Epidemic Resilience and Impact, which was translated into Spanish, and it would be Erradicar la epidemia de VIH y SIDA, Resiliencia y Impacto.
So what's HIV, you might be thinking? HIV is a virus that attacks the human body cells and makes them weaker and helps it easier for infections and disease to affect the body and to make the body more vulnerable to these kind of infections. It can be spread through body fluids with HIV person, and that could be happening through unprotected sex, so basically sex without a condom or oral sex, and can be also spread through injection drug equipment, so like syringes and so on. So taking HIV medication is important, and we're going to be discussing that in a few minutes. However, HIV is not treatable. However, ART, which is the treatment that an individual with HIV can go through, can help them to live longer and healthier and be able to have HIV less potentially distressing to their body. And a person who is dating a person with HIV can take PrEP, which is a pre-exposure prophylaxis, and post-exposure prophylaxis, and that could be taken throughout their sexual contact.
So symptoms. Some early symptoms are of HIV are we're going to discuss, but it's also important to know that not everyone gets all of these symptoms, or some will get all of these symptoms. It varies by person. One of the most common ones would be fever and chills, headaches, and mood swings. More of the throat would be sore throat, swollen lymph nodes, and mouth ulcers. Lung-wise would be pneumonia, cough with phlegm, shortness of breath, and chest pain. You could also get muscle fatigue and body aches. Nausea, vomiting, and loss of appetite is also one. High heart rate and low blood pressure, as well as clamminess, rashes, and blueness of the skin. In your hands, you could also get joint pain, and for women specifically, you do get changes in menstruation, lower belly pain, and vaginal yeast infection, which comes down in the later stages of infection.
So, what is AIDS? What does AIDS have to do with anything with HIV? So, AIDS is the late stage of HIV itself, where the body is badly damaged of the virus and it's really vulnerable. If anything happens around that person, they will get the infection or the disease. And without HIV medication, it's sad to say that a person with AIDS could live only up to 3 years, not more than that. And once someone has been dangerously optimally illness, their life expectancy without the treatment will fall to about 1 year. So that's why art is really important to have it and have it done as long as as soon as you find out that you're HIV positive. HIV medication can still help people in this stage, and it can help them to life saving them, which is art that we have talked about before. And soon after getting the HIV experience, more benefit. And that's why HIV testing is always important. And it's always good to have it done every 6 months.
So, dating and domestic violence, and why is it important in HIV? Dating and domestic violence is a pattern of unwanted behavior in a relationship where one is trying to gain power and control over the intimate other. So, what does this may look like? Physical abuse. This would mean having forced sex or disregard of their partner's unwillingness to have sex. An example would be you telling your partner no consistently and them disregarding it completely and still going ahead and forcing you to have sex. Another one would be mental abuse, which would be demeaning the victim either privately or publicly. Financial abuse would be controlling all the finances, which would mean if you get paid, they completely get your check, or they have all your cards and they just completely balance that out. Um, Another one would be verbal abuse, which is embarrassment or humiliation of the victim in front of others. How does this differ from mental abuse? Mental abuse is more so demeaning you by mentally like telling you things that they know are sometimes going to leave you in a weaker mental state. Verbal abuse would be embarrassing you in front of people or humiliating you, and they just get joy out of doing so and bringing you down and making you feel like you're less.
So, what's the connection between HIV and dating and domestic violence? So, there are 5 things that can happen within that. First thing is hide. So, your intimate partner or you yourself could be hiding the fact that you're HIV positive from your significant other, which could be really, really risky, considering that your partner will be more vulnerable to get the HIV virus. So, it's really important to make sure that you tell them upfront. Force. Forcing them to have unprotected sex, although you know that someone of you have HIV. And in that, you're basically asking for HIV to be transmitted to your significant other, and that's not a good thing, and that's why it's considered abuse. Third, it's prevent. Preventing your significant other from taking medications to prevent them from having HIV, so that could look like the PrEP and the PEP, which is pre-exposure prospects and PEP exposure prophets. And fourth, refuse. You yourself might be an HIV positive person, and by you refusing ART treatment, you're making your intimate partner more vulnerable to get the virus. So make sure that you're not only preventing it from your intimate other, but you yourself are actually getting the treatment yourself. And lastly, outing someone for being an HIV positive. So HIV is a stigma that a lot of people don't want to identify with. It's not funny, sadly enough. However, some people are not ready to be identified as HIV positive. So please consider that when you're talking when someone is HIV positive or negative. And here are some statistics that we wanted to introduce for you. So this study was done in an herbal clinic, and they have seen a kind of pattern between the abused relationships and the non-abused relationships. So if we zoomed in a little bit, we would see that males have gotten the virus if when they were abused, 27 male got the virus, and when they were not abused, 11 of them got the virus. And with women, 14 and 4. So 14 was abused and got the virus, 4 were not abused and still got the virus. However, if we go back a little bit and look at the bottom here, so usually HIV comes with the stigma that homosexuals is the most people that gets HIV and the ones that brought HIV to our world, which is not correct. As we see here, in homosexual relationships, 14 were abused and got the virus, and 5 were not abused and still got the virus, comparing to heterosexual relationships where 21 were abused and still got the virus, and 10 were not abused and still got the virus. So the numbers were almost doubled in here between heterosexual relationships and homosexual relationships. So that's another stigma that comes with HIV.
So I just found out my friend is a survivor. What can I do? The first thing you want to do is listen to them and respect the fact that they even have the courage to tell such information. We all know it doesn't come easy to trust that information into another person, so definitely listen. Another thing you want to do is refer them to resources instead of making the decision for them. That would mean you would give them resources that we're about to this instead of telling them you have to do this or I'm personally going to report it. Another thing is you want to protect their privacy. This is very, very important because, like we said earlier, they have the courage to tell you this. This doesn't mean you should out them to everyone and tell them, hey, this person is HIV positive, because it's a personal matter. The last thing you want to do is remind them that it is never too late to take action and to start getting treatment for HIV.
So what are some community resources that a person with HIV want to reach out to? So first thing we have is the California HIV Spread AIDS Hotline. They can help you with providing stuff, treatments, areas, or where to go get tested. In case if you were in a relationship with HIV positive dating domestic violence relationship, this phone number, the next phone number, will help you to investigate how you might want to go about reporting it. And it's that phone number. It starts with 212-430-6734. And then on the third bullet point, we have the dating violence hotline. You can call or you can text. They're 24/7, 7 days a week. And lastly, if you wanted more information about HIV, you can always call the CDC 24 hotline at this phone number.
So, some campus resources. We're going to go over confidential resources and formal reporting in the next slide. So, formal reporting. This would be UCPD or any other police department, which would be 209. The phone number would be 209-228-2677. At UC Merced, it is known as CAT COPS. We also have the OPHD, which is the Title IX office, and it's 209-285-9510. And we'll also be going this in depth in the next few slides. And any responsible employee that is not listed as confidential, all of these for formal reporting, they do want to report something, they do have to make a report. Some confidential resources would be the care office and our campus advocate. This number is 209-386-2051. We also have CAPS, which is Counseling and Psychological Services. The phone number is 209-228-4266. And there are unlimited sessions. We also have Office of the Ombuds, which is more of a conflict resolving office. The phone number is 209-228-4410. We also have a great relationship with the Valley Crisis Center. And their 24-hour hotline is 209-722-4357. And the last one would be our health center, which can provide you with any resources that you need for getting treatment. And the phone number is 209-228-2273.
So what are responsible employees and why is it important to know that? So it's important to know that UCM employees have to report any sexual violence or sexual harassment disclosures to OPHD, also known as Title IX. So a good example for this is basically if a student is working at the Lantern and their coworker came up to them and told them that they are feeling uncomfortable and being explicitly harassed by comments made by some other coworker at their workplace, that person have to report it to Title IX or to their supervisor. However, if the same student was disclosed with similar information, but they're not on the clock, they're not working, they're just hanging around with their friends in the library, they don't have to report it since they're not on the clock. They're it's basically confidential. It's between two friends.
So, who classifies as a responsible employee? Employees who do have to report include faculty, resident assistants, which are the RAs, teaching assistants, where are the teacher assistants, student employees, and any staff who is not listed as a confidential resource.
So Title IX office. So Title IX conduct investigations and process complaints regarding these following categories: discrimination against protected classes. That could be race, age, gender, and medical condition, which HIV would fit perfectly in this one. However, it's also good to know that they do similar things with sexual harassment, sexual violence, sexual assault, relationship and dating violence, and stalking as well.
So follow us on social media. We do have Twitter, Instagram, YouTube, Facebook,